Well, as winter approaches, cases of COVID-19 are rising across Europe. Eastern Europe and the Balkans are seeing the highest numbers, and some countries and cities are turning to lockdowns to pull them back from the brink. And Latvia has the highest rate of new cases of any European Union country, with nearly 900 cases per 100,000 residents reported in the last week. The government imposed a nationwide lockdown on October 21st, the first in Europe this autumn. Now, EU members Slovenia and Estonia are also considering lockdowns. Both of them are also seeing a weekly case rate of over 500 per 100,000 people. And in all three of these countries, only a little over half of the population has been fully vaccinated. DW correspondent Teri Schultz reports for us from the Latvian capital, Riga.
The Latvian government hopes this 4-week lockdown will give it time to curb the record-breaking climb in infections and to convince more of the population to get at least their first shot.
If we do not have a spike in the demand of vaccination during this lockdown period, then it's going to be bad.
Epidemiologist Nikita Troyanskis is the country's vaccination coordinator. He warned authorities months ago they weren't doing enough to prevent this wave. It will be a few days before it's known whether the lockdown is enough. But that's too late to save hospitals and healthcare workers from being overwhelmed now.
Every morning starts with trembling hands looking at the numbers.
This entire hospital has been transformed into a massive COVID ward. What would normally be the urology department, for example, is now awaiting patients with intensive breathing problems.
This area used to be a scenic entrance hall. Literally overnight, it was transformed into the latest overflow intensive care unit, which communications director Janita Weinberga says is likely to be full within days.
It is an enormous struggle to arrange all the plans, which units need more nurses, from which units we can borrow those nurses.
But besides the virus, something else is spreading in Latvia. Blame for how it got to this point, from almost zero infections 3 months ago. Many people tell me the Latvian government botched its outreach on vaccines, particularly to the Russian-speaking minority, which was more hesitant to get the shot. Too little accurate information, too much disinformation, says parliamentarian Nikolais Kabanovs.
Latvian Russian population still is in the information space of Russia, because last 3 decades Latvian government made very poor communication strategy with these Slavic groups.
There was a lot of wrongful information, actually lies, in social networks.
Due to this, Dr. Ilse Kreutzberger says some patients who had always trusted her with their lives questioned her recommendation to get vaccinated. Adding to society's confusion, some doctors openly disagree with the government policy.
I don't think we should push anything in medicine.
But Nikita Troyanskis says the only way Latvians will get out of this crisis is to increase immunizations.
For those who have been skeptical before, to change their mind, and for those who have been shy to decide now.
And now the government is adding more pressure, suggesting restrictions will be lifted in November only for those who got the shot.
And we can take a look now at some of the other developments in the pandemic. In Germany, the Robert Koch Institute is warning about the rising number of infections. It's reported nearly 25,000 new cases and 121 deaths. Meanwhile, the Pacific island nation of Tonga has reported its first ever case of COVID-19 after a traveler from New Zealand tested positive. And South Africa is setting up vaccination sites at polling stations for next week's local government elections.